here is your question. Right, so if you have read and understood, considering it communication skills station, kindly begin.
Okay, ma'am. Hello, good morning.
Hello.
Myself, Dr. Jatin, I'm one of the surgical SHOs. I'm working for Mr. Mann at New Cross Hospital. And I'm calling to speak to Mrs. Lina, an Icu Registrar, to seek an advice for an unwell patient for which we are planning a laparotomy today. And I would also like to make a request for the arrangement of post-operative bed in ITU for this patient. Can I check that I am talking to Mrs. Lina, the Icu Registrar?
Yes, I'm Mr. Lina. Please summarize your case.
Yes, ma'am. Mrs. Janice, 76-year-old female. She is a known case of diabetes mellitus. And she is a known case of COPD. She presented to us with the perforated viscous and is planned for the laparotomy today. Her blood investigations shows that there is an increase in the urea and creatinine, and there is a hypokalemia. Her ABG shows that there is a metabolic acidosis with high lactate levels and high negative base excess. And we did ultrasonography of her abdomen, which shows a free fluid. Based on above findings, I would like to get a advice for this patient for the proper optimization before going to the laparotomy, and also would like to make a request for the ITU bed, ma'am, post-operatively.
Okay. Why do you think that this is a perforated viscous case?
Ma'am, we did some examination of this patient, and it shows the sign of peritonism, and there is a drop of hemoglobin by 2 gram. And also her ultrasonography of the abdomen shows there is a free fluid present inside her abdomen. So these are the findings which suggests there is a perforated viscous.
Okay. What fluid resuscitation will you do?
I would like to follow the ABCD protocol based on the care of a critical ill surgical patient. And for that, I will follow the airway assessment and management, breathing assessment and management, circulation assessment and management, disability, and the exposure of the patient.
And the fluid resuscitation, how are you going to do that?
Yes, as the patient is drowsy, and first of all, I would like to check the patency of the airways, and then would like to see the saturation of this patient. And if the patients, and I will give the high flow oxygen to this patient, 12 to 15 liters, and then we'll assess for the ventilation part. And if the patient will not be having a proper ventilation, we will go for the invasive or non-invasive methods. And then we'll
Doctor, if I could just interrupt you.
Yeah.
What is the fluid regime you would start? The fluid regime that you would start?
Okay, so for before beginning the fluid resuscitation, I would like to see the peripheral access of the venous access. I will go for the wide bore cannulas, and then ask my assistant to give the crystalloids. I'll flush with the will give crystalloids to the patient. If the patient will not respond to that, will show no response to that, will go for the colloids to this patient. And as the patient is there is a patient is showing there is a drop in hemoglobin, I'll also send the samples for the group and save to transfuse the blood. If the patient will not show any response to the crystal
How
and
long? How long would you wait?
First of all, I will wait for the 30 minutes.
Then?
Okay.
And then again, I will reassess, give another fluid challenge and wait for 30 minutes. And then if the patient will not respond, the patient is a non-responder, then I will give the fluid to this patient. Sorry, blood to this patient.
What are the criteria for ITU admission of this patient?
As this patient will be this patient is one organ is chronically impaired and other organ is acutely impaired, like so this patient will be requiring a ITU bed. Like the patient is a known case of COPD, and the patient is also going into acute kidney injury.
Okay. You said the patient is a known case of COPD.
Yes.
So, yes, what type of oxygen mask will you use for this patient?
Yes, for this patient, I'll use a Venturi mask.
Okay. What are the preoperative arrangements you would do for this patient?
First of all, I'll keep this patient NPO, and then I will put NG tube and urinary catheters, and then I will send the full fresh blood investigations, which baseline blood investigation, which will include CBC, LFT, KFT, urea, and electrolytes. I'll repeat for the ABGs and X-ray chest and ECG to look for any atrial fibrillation and then or is there any signs of hypokalemia. And also I will start the antibiotics to this patient according to the local hospital guidelines, and then I will keep the saturation of this patient to lower limits, as the patient is a known case of COPD, and as the patient is also on steroids, I'll convert it into the IV hydrocortisone steroids, and I will involve the anesthetist for the preoperative assessment of this patient.
Okay. You say that the patient, could you please tell the arterial blood gas analysis finding of this patient?
Yes, the patient is having a metabolic acidosis with high lactate levels.
Okay. Well, and her potassium level is?
The patient is in hypokalemia.
So how would you calculate the potassium deficit?
The normal limit is 3.5 to 5 millimole per liter, and the drop in 0.3 millimoles is equal to the drop in 0.3 millimoles serum potassium is equal to the total body deficit, 100 millimoles of the total body deficit. So like in this patient, if the patient is having a 2.6, so it will be near about 300 millimoles of the total body deficit.
Okay. Can you tell me what the findings what findings will you get on an ECG?
On an ECG, because of the because of this condition, there could be findings of atrial fibrillation.
Okay.
Yes, there could be irregular rhythm, and there could be absent P waves. Or in case of hypokalemia, there could be a T wave inversion or the.
Okay. All right. This patient you said is on hydrocortisone, right? So what is the complication? What are you fearing the patient could go into as a complication of steroid?
Patient can land up into the Addisonian crisis.
Good.
If we don't put the patient on IV hydrocortisone.
All right. I have at the moment only one ITU bed left, and in case an asthmatic patient comes in, then how are you going to manage that?
In that case, ma'am, I will continuously monitor this patient in the recovery room, and I will involve the Icu Registrar for the further management of this patient. And I'll keep in contact with the bed manager till I get the bed in the ITU.
Okay. Can you please tell me why the fraction of inspired oxygen is not, how much is it suitable for a patient with COPD?
It should be near about 24 to 28%.
Okay.
As a patient of COPD, they maintain their saturation with the low ventilated drive, with the low oxygen drive.
Okay. All right then. Can you please tell me why the patient might have lactate high? Why is there high levels of lactate?
It could be, ma'am, because of the sepsis, or it could be because of the hypovolemia. So as the patient could be in the hypovolemic shock.
All right.
And
okay, thank you, Doc. Yes.
Thank you. Is there anything, ma'am? Is there anything that?
No, doctor, it's all right. So you can summarize your case, please.
Okay, so ma'am, there is a patient, 76-year-old lady with the background of COPD. She is having a perforated viscous, and we are planning for laparotomy today. And we have made a proposal for the pre-op optimization of this patient, and also for the post-operative bed, for the arrangement of the post-operative bed in an ITU.
Okay. All right. Thank you, doctor. I'll let you know as soon as we have a bed available.
Good. Okay. Thank you, ma'am.
Thank you.